Just feels like 57 years. News today on the numbers is relatively good. The descent continues, and that's a very good starting place. We are now back to where we were on March 31st, before we started this dramatic increase in the number of cases. We're still watching big questions. How fast does that number continue to come down? First, does that number continue to come down? Because that would be a nightmare if it ticks up. And how fast does it come down, and how low does it go, right? Before we started this, you only had a couple of hundred cases. When do we get back to a couple of hundred new COVID cases going in? The overall hospitalization rate is down. The number of intubations is down. Even the number of new COVID cases is down, still not good. Still 1,000 new COVID cases yesterday, to put it in focus. That would normally be terrible news. It's only not terrible news compared to where we were. This is just terrible news. 367 deaths, which is horrific, and there is no relative context to death. Death is death. 367 people passed, 367 families. What I've been working from day one is to make sure that people understand the facts of what we're dealing with, because this is a unique situation. Government really can't act unless the people fully support the action. What we have done here, government couldn't do. It was a pure function of what people did. So my plan all along has been give people the facts, and if they have the facts, they will act responsibly. But they have to have the facts. They have to buy into the plan. And it really is an individual decision, right? Who's taking care of your health? You are. We're mutually dependent in that what I do can affect your health. But it really comes down to giving everybody the information so people can make their own decision. And the great achievement in this period has been that when people get the facts, and they trust the facts, and they understand the facts, they do the right thing. And that is a lesson that I hope people remember after this is all over. But we still have to remember the facts. And we talk about reopening, we talk about reimagining. Let's start to put some meat on the bones of what we're talking about so people understand. The federal guidance from the CDC is that before you start reopening, the state and the regional hospitalization rate must be in decline for 14 days, okay? That's the CDC's guidance. The federal government leaves it up to the states, it's up to the governors, but they also give guidance. And in this case, I think the CDC guidance is right. So we're monitoring the hospitalization rate. We're monitoring the regional hospitalization rates. We said in this state, it's a very diverse state. Upstate regions are like states in the Midwest, even out west. And we have very different hospitalization rates. So we look at the rates all across the state as well as across the regions. We're going to reopen in phases, a regional analysis on what we call our economic regions that